Yeah, Honorable Dato and our guests. It's been a good opportunity for me to be here for answer the very question. Yes. Do cancer be prevented? Next slide, please. Before we going to the topic, whether or not cancer be prevented, I would like to introduce a little bit about what the cancer is. Actually, cancer, they have three characteristics which is unique for those kind of cells. First is they grow very fast and without any control mechanism. And secondly, cancer can invasion, can eat up your organ and all the structures that surrounding them. Like if they close to the artery, they can enter into the artery. If in the liver, they can enter into the bile system. And the last characteristic of cancer is it can spread. For example, it can go outside the place of origin. So cancer in the colon, they can go to the brain, they can go to the lung. This is a very characteristic of cancer. Next, please. And before we know that how we can cope with the cancer, how we can do the fast and early screening, and how we can protect ourselves from cancer, maybe we need to know why people have cancer. Actually, we cannot pinpoint that this one cause cancer, this problem have the reason that people have cancer, because cancer is very complex disease, and at least they have three different kind of mechanisms that's causing the cancer. First is the factor outside your body, like toxin or virus and bacteria, and secondly, it is your own mechanism. It is how good you detox yourself when you receive the toxin from outside. And it's the good that how you can repair your DNA if it's break or if it's damaged by the free radical or oxidative stress, which is coming in by the toxin or by the contamination, pollution, and also how good you suppress the bad cells. It is also the intrinsic factor. It's factor inside your body. How good you can suppress when the bad cell coming up. Dr. Lodi already explained that we are not much repair, but it's we just kill them or we just remove them. If we have a disease cell, we just remove them. And how good we remove those disease cells so that have enough places for the new cells to come in, the good cells. And the last factor is the lifestyle and also the aging process. Also, one reason that people have cancer. Next, please. We live now in the environmental and in the environment that have too much toxin. And we also expose ourselves to more radiation. And also pathogens still there that also, this is all the extrinsic factor. Next, please. When people smoke, actually inside the smoke is not only nicotine that already you already know, but it's about the 2 dozen of chemical, and all of them is the cancer-causing substance. And most importantly is the benzene. Benzene is it's the most important carcinogen in the smoking. Thank you. Yeah, next, please. And also talking about the industrial pollutant. Now, you know, everybody can expose ourselves to the dioxin. Next, please. Dioxin is the environmental toxin that already contaminated in all the food chain. So when we check what where the dioxin from your diet, you see if you eat beef, if you eat dairy, if you eat milk, if you eat chicken, If you eat food, you get dioxin. That's it. Yeah. Yeah. Even the you know, if you eat soy, you also get dioxin because dioxin is in the soy. Yeah. But if you eat plant, there will be less than soy because plant can absorb some dioxin. But it's accumulation in the food chain. It's a human food chain like beef, like chicken or egg. Yeah, next. And dioxin is one of the most important carcinogen in our world today. And also the toxin from fungus can cause the liver cancer also. Next, please. Yeah, as the study, a recent study, they found out that among 17 substances that cause breast cancer, the most is the benzene. Yeah, and you get benzene also from cigarette and also from, you know, you walk into the road, you drive, and then you get the exhaust from gasoline, and gasoline exhaustion is benzene also. Next, please. And this is the prevalence of the benzenes in your air. And for example, if you go to China, you work for 1 month, or to the South Pacific or the African country or some European country also, they have a lot of benzene contamination in the air pollution. Luckily, the U.S. is among the lowest benzene. Yeah. Anyway, it's prevalent. Yeah, and I have so many patients who have to work in China. Every month they come to see me and do some chelation therapy or some detoxification because they know what they're exposed to. Next, please. And this is if we make a calculation of benzene's exposure, actually human benzene's exposure mainly from cigarette smoking. Yeah, and second from automobile exhaust. Next, please. Yeah, not only the food and also the way how you eat the food. For example, if you cook the food and if you fry them, the fried food, because of the heat, they can generate polycyclic aromatic hydrocarbon, and this one, it's one of the remarkable carcinogen. And they have a study in the U.S. Even the healthy food like salmon, smoked salmon, also contain certain amount of polycyclic aromatic hydrocarbons. Next, please. The radiation also causing the DNA defect. For example, when we compare people in Detroit and Dallas, which Dallas is mostly, sun, and Detroit is mostly cloudy, and we found the skin cancer is different among those states. Next, please. We can also expose ourselves to ionizing radiation from cosmic ray. People who work in plane, or nuclear fallout, or radon gas, or even the annual screening, from X-ray. Next, please. And this is how the radon gas from the soil, from the underground, they contaminate your house. Yeah, and they can contaminate in the pipeline. They can enter into some leak pipeline, or even they can go to some crack, or even the basement. They can go to the basement and contaminate in your house. Yeah. Next, please. And this is the map of the radon gas exposures. Among the red is the people at risk because of the high radon gas in the underground. And actually, radon gas is the radioactive substance. It's like you have a nuclear inside your basement. So this is This is something that causing the problem and is related to the lung cancer. Next, please. And this is how you prevent the radon gas to contaminate your house. And actually, they have a test kit that you can buy, and you can check, especially if your house has the underground floor. Then you can check whether or not the radon gas is leak. Especially, you can see the map. And this map is for the US only, but for other country, there have been no study before. Next, please. And also the metal also the carcinogen. Arsenic can cause the skin and lung cancer. Cadmium may be related to cancer also, and lead also kidney cancer. Probably the carcinogen. Next, please. Even the healthy food like fish, because actually it's the bioaccumulation. When volcano eruption, which is natural, or coal plant, they emit the mercury out of the environment, and then they fall into the rain and fall into the ocean. And the krill, they accumulate a small amount, trace amount of mercury. But the salmon and some fish, they eat krill. But for their lifetime, maybe they eat about 1 million krill. So they accumulate 1 million times of the krill, right? Because mercury can accumulate in the tissue. Then the tuna, especially the tuna that they make, the tuna can, is very high amount of mercury, because tuna, they eat small fish. And the shark or bigger fish, they eat this fish, then they have accumulate their mercury more and more and more. So this one you can take unlimited, but you have to limit your fish intake if it's fall to the category that the higher amount of the mercury contamination. Next, please. And this is the food that you can take. This one you need to limit intake, and for this group you need to avoid. Shark fin, for example, you need to avoid completely. Yeah, good one for Chinese people. Yeah, shark fin, they like it. Yeah, it's happened in every dinner set. When we have a meeting or something special occasion, one of the menu is shark fin, because it's considered the best one, and yes, the most dangerous one. Yeah, it's falling to a very high degree of mercury. Next, please. And this is the warning. Yeah, this is the warning that even what you consider maybe your whole life, that fish is the healthy food, right? And when somebody in your family got pregnant, then you urge them to eat more fish because it's good. They have the EPA, DHA, is good for the fetal brain, like that. But actually, the advice is the pregnant or nursing woman shouldn't eat fish. Yeah, because of contamination. And this is actually come from authority. Yeah, government authority. Next, please. So that is a extrinsic factor, and the second factor is the intrinsic factor. Yes, I already told you that aging is one of the problem. People get cancer because they age. This is because, like Dr. Lodi told before, that all of your cells, it's not immortal. They need to die, and they need to be replaced with a new one. And actually, the way that your body replaces the new one is because you have stem cell in your body. Once you age, your stem cell decrease the functionality, and you also have a less degree of replacement. So when cells aging, it's too much dying off. For example, you have too much bad cells. If you cut or die, make them die all, then your body also die. So they manipulate themselves to, admit that you can have some abnormal cells. Otherwise, your body die because it dies so fast. So that's why aging have a cancer incident high, because the ability to replace is reduced. And DNA repair, actually our body have a mechanism of repair ourselves, but it's some it's lost. Some people, they lost their DNA repair in the age of 20, so they got cancer on 25 years old. Some people, they can maintain their DNA repair until they're 60, 80, 90, and then they got cancer because of they lost the ability of DNA repair, and also your detoxification mechanism in the body, which they use liver, they use different kind of the enzymes in the body to remove the toxin out of the body. And also the tumor suppressor functionality. This is like a brake. When, for example, if you have too many cells, dead cells, and they try to clump together, and then they multiply a little bit higher because they change their genetic material so that they, they multiply too fast. Then they have this one like a pedal, like a brake. So they put a brake, they stop production of the new cells. So if you lost the ability to brake, then you have no brake. So you have cancer because they grow. They never stop the growing. And also the factor inside all that I talk, it's about variation inside your body, because people, they have such kind of variation. But this factor doesn't mean that if you have genetic variation, you got cancer. No. It's about the interaction between intrinsic factors and extrinsic factor, and also your lifestyle. And we call it the cancer susceptibility syndrome. If you carry some defect in this mechanism, in this four mechanism, then you have easy to get cancer. Yeah, you can get cancer easier than other people. And I have some of my patients, they told me that I eat a very good food, I exercise, I never drink, I never smoke, but why I got cancer? This is this is common, and this is because maybe internally you have some kind of the inability to do the normal job, the different kind of the job that you should do it, but your body just cannot do it. Next, please. Yeah, look, you can see if you are 60 years old, then you have incidence of cancer about triple time than the young adult. Or if you now already 20 years old, you already 600 times higher incidence of cancer. Yeah, it's like that. Yeah, it's like that. If you age, you got more cancer and more and more and more. And especially if you are a male, you got cancer more than female when you age. Yeah, because male, they have testosterone, they have metabolic, they like, their hormone is active, but the female hormone, the hormone seems to be like drop so fast, and then they become inactive a little bit. Yeah, please, next, please. This is the problem in the biomolecular in your body. For example, if you smoke, it may be the smoking is pre-carcinogen. It's just the toxin. It's not the carcinogen yet. But if you have some molecule in your body, it's become hyperactive activators, then all the pre-carcinogen become carcinogen. And if you have lazy activator, this is controlled by your gene. And if you have lazy activator, you have carcinogen build up the whole lung, but no cancer. So this is explained why people smoke every day and they don't get cancer. But some people, they don't smoke, but they get cancer because they secondhand smoke. Yeah, when they are very young and their parents smoke, and then they receive the pre-carcinogen when they are just 5 years, 7 years old, and then they never smoked before. But because they have hyperactive activators, then they have carcinogen the whole body, the whole lung, and then they get lung cancer. This is why Some people get cancer, some people not. Some people can smoke the whole life without cancer. Some people even not single smoke cigarette, but the very trace amount of secondhand smoke, they have cancer. Next, please. This is also the detoxification. And if, for example, you have your gene can produce the detox protein. So when you have carcinogen in your lung, then they make water soluble, and then they expel from the from the body through the kidney, through the urine. But if you have slow detox protein, because your gene stop working, your gene have some variation that they don't make a detox protein. Then your carcinogen build up in your body and you get cancer. Yeah, next please. And actually, they also have some variation also. For example, when you start smoking, they switch on some gene inside your body. Yeah, they switch on some gene. And pattern A, so after many years later, you got cancer. But if the pattern B, you get well. It's like this also in some situation that we put, the input is the same, but output may be different, it may be vary, because intrinsic factor. Next, please. Next is the lifestyle. Yeah, you already heard from Dr. Lodi that he emphasized this a lot in his presentation. Yes, diet also an important factor, also physical activity and obesity. Next, please. Yeah, studies show that if you, carbohydrate, sugar, and white flour and corn syrup, they cause cancer. This is published in the Journal of Cancer Epidemiology. Yeah, yeah. If you take high carbohydrate, you get cancer. Next, please. And also, cancer cells, they love high fructose corn syrup. Yeah, this is the you see a latest study, and high fructose corn syrup now it's happening in our food industry. They use it because it's make you feel sweet very, very fast. Can drink, soft drink, in every candy, and everything they use the high fructose corn syrup because they make you feel sweat very fast. Yeah, and then they also put the sugar so that you can have a sweet taste, prolong the sweet taste, because the fructose seems like sweet and then disappear. So they put fructose and they also put sugar. And sometimes they don't use this term. They change like corn, something like sweetener from corn. Sometimes they try to avoid this, but actually it's the high fructose corn syrup again. Yeah, please. Next, please. This is the meat consumption. They map people from Germany, people from Canada, from US, from New Zealand, from Japan, and how much they take meat. And it's appear that it seems to be like very, very strong incident that if you take more meat, you get more cancer. Yeah, you see the graph. It's like this. Japanese is here, and US and New Zealand is like this. So if you take more meat, you get cancer. Next, please. And also obesity. Obesity now, this is already, they found the relationship between obesity and cancer. So if you're obese, you have more incident for breast cancer, cervical cancer, ovarian cancer, colorectal cancer. In men, you have more incident in prostate cancer. So now, today, from now on, exercise and reduce your weight, change your lifestyle, and squeeze out some of your fat, belly fat, and reduce your weight, and you don't get cancer. Yes, the fact is like this. Yeah, it's like this. There's this statistic. Yeah, it's already published. Yeah, it's already published. Next, please. So, people have cancer because they have extrinsic factors, they have intrinsic factors, and they have lifestyle factor. And those interaction We don't know. It's like a black box. Some people, they have this one. Some people, they don't have this one, but they have this one. It's like a black box. We don't know it. We don't know it. We never know it. Yeah. But more importantly, yes, lifestyle factors seems to be more importantly, more and more and more, because you know why? Because when you have some gene, actually the gene shut down when you born. When you were born, the gene is not open yet. But because of some factors, some extrinsic factors and lifestyle, they just open up some gene and close some gene. For example, they open up the gene that make the cell grow fast, and they just shut down the gene that produce the protein to detox. So this is why the lifestyle factor is very important, because they control the genes again. It's we call it epigenetic factors. So now it's not anymore talking about the gene. We talk about above the gene, which is the epigenetic factors. In the past, maybe people call it's from upstairs, it's from God. But Dr. Lodi told that it's not about the God. The God doesn't mean to, put this cancer to the patient. But this is actually, it's your responsibility. Yeah, it's your own responsibility. But why some people, they very carefully, control everything, but still got cancer? Because maybe some intrinsic factor is very strong. Yeah, you have some defect. And this defect, I told you, usually they have reason. Some people, they got a very severe infection. They do some antibiotics, and they just react different way, and they just turn off some gene. Yeah, or some people maybe, happen in the lifestyle, like even emotional factor also can cause, turn on and turn off the gene. This is already proved by some study. Next, please. So interaction between the extrinsic factors and intrinsic factor under lifestyle and aging factor, then they're causing, mutation that regulate the cellular proliferation. So actually, the summary, the conclusion of this is cancer is the interaction between the abnormal cells. Actually, those abnormal cells, they mean to apoptosis, they mean to die, they mean to should eliminate out of the body, but their interaction with environment, yeah, and result from uncontrolled cellular growth. Next, please. For example, if we have cell damage, actually our body not permit that. They need a suicide. They have a suicide mechanism. But the cancer happens when you don't have this mechanism, and they collect more and more and more change in your DNA, change in your genetic material. Yeah, change more and more. From second mutation to third and fourth mutation, then you have the real cancer, the big one. Yeah. Next, please. So why? Why the body need that? Why the body have to do this? Actually, some scientists in the past, they throw the metabolic theory of cancer. Maybe I cannot go to all those details. Maybe next slide, please. Okay. In summary, in short, because of those intrinsic and extrinsics and lifestyle, they damage the cellular respiratory mechanism. They cannot breathe anymore. Actually, our cell, the whole body, they breathe. They need oxygen, and they need glucose. They need enzymes so that they can make energy. But if they damage, then they switch from oxygen respiration to glycolysis to replace because they still need energy, so they put more on glycolysis. By this, putting more glycolysis, they need to change their genetic material. So this is the mutation happen. Actually, cancer is mean nothing. Cancer is just a mechanism for them to survive. Actually, they need to survive because you or some factor that I already talked about, causing some problem. And if they don't change themselves, they just die. They just die. And cancer happen because they don't want to die. They just want to live. So they change. They increase glucose uptake, and then they change some of their gene to out of our control. Next, please. For example, this is the healthy cells. They need glucose, they need oxygen, and they can produce 36 ATP. This is the unit, energy unit. But if they become, lost the ability to use the oxygen, then they use glucose and they produce the acid, and then they get only 2 ATP. That's why they need to change themselves, because 2 ATP is not enough for them to maintain the integrity of their cells. So they change their genetic to, channeling their way to, out of your normal control mechanism, so that they can survive. Next, please. Now I would like to discuss a little bit more on whether or not different kind of cancer, they have different risk factor. Because if we know that if something become the risk factor, then we can maybe more or less we can reduce or prevent the cancer. Next, please. Study identified that if you smoke, you have more cancer. If you get the TB infection in the past, those TB scars can become the cancer. And if you expose with the airborne or chemical and particles and pollutant, you get more lung cancer. Next, please. For the liver cancer, yes, hepatitis C and hepatitis B virus causing this cancer. And if you take alcohol, you contaminate with the fungus toxin, you get liver cancer. Next, please. For the breast cancer, it's associated with the meat consumption. Yeah, if you take more meat, you get more breast cancer. And also the benzene, and also the cleaner. Yeah, the cleaner that we use, usually they use some solvent in the cleaner. They also, among the 17 high priority chemical. This is actually identified by some scientists in institutes, Silent Spring Institutes, and they publish this information that yes, benzene is among the most important chemical that causing the breast cancer in women. Next, please. For colorectal cancer, diet, yes. Lifestyle, if you don't exercise, if you obesity, then you have more colon cancer. If you're smoking alcohol, and also inflammation in the intestine, also causing this cancer. Next, please. For head and neck, yes, you have Epstein-Barr virus that can cause these, the risk factors. Also, smoking alcohol. Actually, 7 out of 10 nasopharyngeal cancer, they have history of smoke and drinking alcohol. Next, please. Now, can we early detection the cancer? Actually, for the state of health, you are healthy here, and then actually it's not that you have the disease here. It's take so many years that you are declining in your healthy status until you got the disease. And the hospital modality, they're designed to detect the disease. They're not designed to detect the healthy. So the blood chemistry, the tumor marker, the urine test, the X-ray, PET scan, CT, MRI, and everything, and all those, they're not detecting your declining in your health. So that's why some people last 3 months, they just do the annual checkup, and doctor said everything fine. Your liver very good. You have a very good kidney, and then after 3 months he have a stage 4 cancer. Yeah, that's why, because it's not enough, and it's not a sensitive modality for the screening of the cancer, because you actually you declining, and cancer may take 5 to 10 years before it's appear. Actually, you already have it, but it's take about 5 to 10 years because before it's appear, before we can detect it, because this detection, the mechanism is too low sensitivity. Next, please. Next, please. Yeah, it's just screen now that you don't have the cancer. So all cancer screening nowadays, it just screen out. Yeah, you don't have it, and then 3 months you have stage 4 cancer. Yeah, it's like that. Yeah, it's always happen, because it's just screen out. So actually, the most important is to assess the risk. Yeah, whether or not you have higher risk or lower risk. Next, please. And the way how to assess the risk, they have the newest way, and also maybe not in the mainstream hospital. They practice among the anti-aging physician and functional medicine doctors. For example, they can check how good your liver can remove the toxin. They can check the heavy metals contaminated in your body. They may check your urine. They may check your hair to check whether or not you have too many metal in the body, and maybe can cause the genetic material to damage, and then maybe one reason that you have cancer in the future. Next, please. This is the liver. Actually, all kind of toxin, they pass to the liver enzyme. This is the internal enzyme. These internal enzymes, they make the toxin become the intermediate metabolite, the mediator. Yeah, and then they remove to the water soluble, and then pass to the urine, and pass to the bile to your eliminate in the feces, in the stool. And for example, if you alcohol here, and if it go into the liver, they change to aldehyde. And actually, aldehyde is about 100 times carcinogenic city than alcohol. So if you lack of some factor here you see glutathione, for example, and methylation and sulfation also. Yeah. Yeah, this is the mechanism that they remove aldehyde. But if you lost the ability to remove the toxin, then it's a waste product. They just accumulate, and then you get cancer because you cannot remove it out of the body. Yeah. So this can be done. The test can check this phase 1 and phase 2. Next, please. This is the sample of the toxic metal screening. Next, please. Next, maybe we also can check the damage to the DNA, like lipid oxidation test, urine marondialdehyde, or guanosine. Actually, guanosine is one of the important structure in the DNA. So if you have hydroxydeoxyguanosine, then it means that your DNA already damaged every day. Yeah, this is a urine test. And maybe check glutathione ratio, because your glutathione, once they work, they become oxidized, they become the bad thing. Then you need the enzyme to remove it back to normal, so that they can work again. But if you have a very bad ratio, your body cannot recycle the bad one, the good one, the bad one to become the good one. Then the accumulation of the bad one, and maybe causing the problem. Next, please. The third assessment that we can do is the immune status. For example, we can check your natural killer cells, your activity also. Next, please. Because your immune cell protect you from cancer. Next, please. Next. Next, please. Yeah, actually, in your body, they need different kind of the cells, different kind of immune cells. They have CD4, CD8, they have NK cell, they have macrophage, and they produce the cytokine, the molecule that can increase the ability of your immune cells to attract the cancer. But NK cell is very important. Yeah, next please. The importance of the NK cell is that they don't need they don't need the memory. That's why they call it natural killer cells. For example, the T cell, the white blood cell, are called the immune T cells. They need the memory. They need to train first, and normally they train in the thymus. After the training, it's like in soldiers that they don't know who is the army, who is the army, or who's the enemy. So they train. But natural killer cell, they don't need the training because they don't need the prime. They don't need the prime. So that's why it's very important, because once you have something wrong, they know it and they attack it. Next, please. And they have anti-tumor response. Yeah. Next, please. So when we detect the cancer, the NK cell activities, this is the tumor, and we mark the tumor with the stain. We stain with the dye, and then we draw the blood, and then remove the NK cell from the patient, and then we put the NK cell to the plate of the cancer cells and wait for 4 hours. And you can see the dye is released from the destroyed tumor cells, and then they can detect the dye. Yeah, they can detect the dye so that they know how many percentage of the cancer cell destroyed by your NK cell. This is the NK cell activity test. Next. So if you have, cancer prone, or if you have infection, if you have chronic disease, if you have liver disease, kidney disease, hepatitis virus, or anything that related to the immunity, busy lifestyle, smoking, alcohol, and non-healthy lifestyle, then you should know now your NK cell activity is still good or not. Because this is one of the very first barrier to protect you from cancer. Next, please. Next is to detect the variation of the intrinsic factors. So we can check how good you produce the detoxifying protein, which it is from your gene. How good you produce some protein to change the cancer cell or suppress the cancer cell. For example, one of the tumor suppressors gene that people know much is the BRCA gene. This is if you have mutation in this BRCA gene, then you have very high incidence that you can get cancer. Next. This is very interesting. One doctor from Japan, Dr. Kobayashi, he introduced the tumor marker combination assay, the TMCA. Next, please. Yeah, and usually when you check the marker, they detect the early cancer in about 20%, but TMCA can detect in 85 to 93%. Remarkable. It's different from the conventional molecular detection, and twice as sensitive as the PET scan. Next, please. Yeah. So they make like they tumor-free, pre-cancer stage A, pre-cancer stage B, preclinical cancer. I mean, you have maybe some cancer already in the body, but not yet detected, or tumor over 1 gram. So, by the very sophisticated algorithm, totally we discussed in the plane that all the algorithm is in his head. So, anyway, this is one of the very interesting, TMCA tests that we can, make an early detection. And one of the good of this detection is that if you do some manipulation, for example, you do more exercise, you fasting, or you do some immune boosting, then you can check again. And if it's reduced, then you reduce your, cancer risk. Next, please. And it's non-invasive. It's just the blood test. Next, please. Next, it's I would like to introduce a little bit about, new molecular screening. Yeah. Next. The PHI. PHI, it's actually it's simple blood test and a simple way of, detecting. And then they can, next please, they can detect or more sensitive than the regular PSA. Yeah, so PHI is a new development. Next please. You can see here for PSA, the specificity is low, but for PHI it's about triple time more specific for prostate cancer than the PSA that we detect annually for male. Yeah. Next, please. Yeah, this is also correlated with the biopsy. So it's reduced the number of biopsy unnecessary biopsy. Next, please. Next. Another one, this one already approved in the United States. Very simple. They mail you the kit, and then you put your stool and put your blood, and then send to the labs, and then they check the DNA. And very, very early, if you have some cancer DNA, they can detect. And it's, maybe early detection can happen, because many of people, they don't like colonoscopy. Even they have painful or some bloody stool sometime, and then they still fear of colonoscopy. This one is very simple, but test. Yeah, then do it at home. Next, please. Next. Maria, I think it will be more and more, readily available, because it's the radar breast imaging system, and they, 8-second breast cancer screening. Yeah, fast and no radiation. Next. Yeah, you see here they have scanner and they have antenna for radio wave antenna, and they produce a 3D image like a mammogram. Yeah, this is very interesting. Next. Yeah, you see here. It's they can scan like like MRI or CT scan or even better than the mammogram, because it's a 3D. Next. How to prevent cancer? According to the study, many as 20% of cancer cases are linked to some type of environmental factor. So. Bottom line is, if to change your environmental factor, maybe you can prevent as much as 50% of cancer incident. Yeah. Next. Actually, this already published by the British study. They have two groups of population. One group, they have a regular lifestyle. One group, they change. And for about 10 or 20 years, the cancer incident is different, about 50%. So the meaning is that if you change your lifestyle, you can cut off about 50% of cancer. Very stunning. And you need to avoid anything that causes cancer. The extrinsic factor that I told you already. Next, please. Yeah, like have some, protection. Next. Yes, tobacco, the most important, because this is number one carcinogen. Yeah, radiation also. Next. Alcohol, tobacco. Yeah. They like boost. If you have together with alcohol and tobacco, it's You know, it's not like 1 plus 1. It's like 1 multiplied 10. Next. More fruit and vegetable. Yes, this is already, you know, many study regarding to the way to prevent yourself from cancer. Just have more fruit and more vegetable. Or eat raw vegan. Yeah. Next. Yeah, you protect yourself from cancer-causing virus. Protect yourself from carcinogen at work. Yeah, if you work in the construction, the mining, the pesticide, underground mining, chemical, dyeing, and plastic, furniture, all those can have cancer-causing carcinogen. Next. The way how you cook, also very important. Yeah. If you cook, they make nutrient become carcinogen. Yeah. Every time you cook, they change the composition of the diet or nutrient become carcinogen. Yeah. And I prefer steam or boil or stew, which is they already detect the level of like polycyclic aromatic hydrocarbon. They, you know, fry for just 5 minutes, and then they stew for 12 hours. And the difference is that 5-minute fry, they have about 20 times more polycyclic aromatic hydrocarbon than, you know, stew for 12 hours. It's like this: low cooking, slow cooking, and low heat cooking is better than, or best, you know, no cook. Just is the draw. Next, please. Yes, this is already discussed. Yeah. Next, please. Yeah, we already discussed this. Yeah, more vegetable. Yeah, next. Carb. Yeah, carbohydrate also linked to cancer. We already discussed this. Yeah, next, please. So, summary, you change your lifestyle. Yeah, change the diet. Change your physical activity. If you never exercise, you do exercise today, in the evening, after the class. Do it at home, exercise. Yeah, start immediately, believe me. If you have to wait for the shoes, have to wait for the shirt, then you don't exercise. You just exercise. You know, I exercise in my shirt, sometimes in this. I exercise in my room, and I exercise 5 minutes before I have a neck patient. I do like this. Okay, neck patient, give me 10 minutes. No, give me 2 minutes. And then I do like this. Yeah. This is already exercise. You do it for 1 minute. And then you got the next job, next assignment or next patient in me, myself. Obesity, you reduce the fat, you cut the, you know, your excess body fat. Yeah. Then you reduce the cancer. Detox. This is you cannot do alone by your own. Maybe you can do, yes, for example, the coffee enema that you can do by your own. But if you do the colonic irrigation, you need to find some, you know, place that they provide the treatment at. And IV detoxification, this is intravenously. They put some amino acid and some vitamin that help boosting your liver to remove the toxin. And chelation, they use another amino acid called EDTA to grasp the heavy metal and then remove through the bile and through the urine. And yeah, next please. Immune boosting. There are different kind of immune boosting here. For example, NK cell activators, GC-MAP protein, immuno-bridge, or immunoblend 42 strain of probiotic. Next, please. Yeah, NK cell activators, they use the GC-MAP protein to increase your immunity. Maybe I don't go for this to, you know, next, please. Just an example that we can do. Next, please. This is in our body, especially our intestine. You know, the longest organ in the body is intestines, right? And also, you know that the most important immune system, our body, and the is also the intestine, because your intestinal lining, they have pH patch, they have the the lymphoid organ, and that lymphoid organ is represent about 90% of your lymph. So immune system in the gut is about 90%. If you treat the gut, you treat 90% of your immune system. So it's very important. And study from the scientists, they found out that about 90% of your normal flora is comprised 42 strain, 90%. And they have altogether 200 to 300 different strain of microflora in the intestine, but 90% of them 42 strain. So if we can replace those beneficial bacteria, replace it back to your intestine, then they produce the immunity. They can produce the CCMAP protein, which is the immune protein, and then they can produce many good things happen. Even they can cut the allergy, because some strain of the probiotic, they produce the some molecule that reduce the allergy, and they can shed your pound away by some amino probiotic here. They just make your body not to store the fat, so use the fat. So with the replace all the good thing. When you take yogurt, maybe you take only one strain. Or if you take a bottle, a probiotic in a bottle, maybe you take 6 or 10 or maximum 10, I think, on the market. Yeah, 7 or 10. But this is 42 strain. Is actually is represent about 90% of your gut intestinal microflora. Next, please. Yeah, vitamin D also very important for the immune system. Next, because vitamin D is linked to the cancer. And if you low vitamin D, you have high incidence of cancer. Next. Actually, vitamin D also have the ability to inhibit the tumor proliferation and induce the differentiation of cancer cell and inhibit the blood vessel formation inside the tumor. So vitamin D itself, not only boosting the immune system, is act like cancer treatment, yeah, by them alone. Yeah. Next. Actually, to boost the immune system, another way to do it is to use the mesenchymal stem cell. Yeah. Actually, mesenchymal stem cell, they can have two different characteristics. One is to boosting the inflammation, acute inflammation, and the second is to stemming down the immunity. So, for example, if you have mononuclear cell here and you unprime them, but you use the unprime MSC, sometimes they can reduce your, your activity. But if you use the MSC1, which is prime to become, cancer fighting, then you increase the ability of the T cells, the immune cells. But if you use the MSC2, they reduce the ability. This one may be very good for allergy and autoimmune disease. This one is very good for cancer. We would like this to happen with cancer. Yeah, this is called the pro-inflammatory MSC or MSC1. Don't confuse with the inflammation. Cancer, they grow by what? Chronic inflammation, not acute one. Because the acute inflammation, they stop making the blood vessels, they destroy the cancer cell. But cancer, they modify our macrophage, they modify our T cells to become the chronic inflammation that your macrophage produce more blood vessel to the cancer cell. It's like, cancer, they talk with your immunity, and then they recruit your immunity to become their alliance, and actually your immunes help the cancer grow by chronic inflammation, by make more blood vessels, by stop the function of the, put the T regulation to become high, very high, to control, more control than kill. But the MSC pro-inflammatory in a MSC, they just turn everything. They just change chronic inflammation causing by the tumor become the acute information which cancer killing, the destruction, apoptosis. So this is one of very interesting cancer treatment. And now we already developed this in the labs, and now we already use in the clinical. Yeah, we already use this in our clinical practice. Next, please. This is our team. They would like me to show. So, yeah, people who make my presentation, they would like me to show. This is our team. And next, please. This is like, you know, a supporting team. And next, yeah, this is meeting, yeah, plan of care meeting, the environment in the work space. And we have been dealing with the cancer patient. Yeah. Next, please. This is some of our instrument. This is they generate the heat by the radio frequency. So this is the local hyperthermia, and this is the systemic hyperthermia. Yes, that's all for cancer prevention. Thank you very much.